Good afternoon. My name's DJ Wells from the University of Illinois at Chicago Urban Health Program, and you're watching Urban Health Hotline. Each week here on Urban Health Hotline, you'll have an opportunity to call in and join us in a conversation about some of the educational opportunities that are available to you at the University of Illinois at Chicago, specifically those opportunities that are in the health sciences. We'll talk a lot about degree programs and opportunities to pursue a degree that will lead to a career in healthcare. And we'll also talk about important issues facing our community as it relates to healthcare and health disparities. Remember, this is a call-in show. It's your show. We would love to hear from you if you want to be a part of the conversation. If you have any questions about any of the things that we're talking about while we're on the air, please call in. The number is there on the bottom of your screen there, 312-738-1060. The phone lines are open, so you can call in at any time. I'm joined today by one of our Urban Health Program students, Ms. Brianna Hyde. And Brianna is a student who has worked with the Urban Health Program for several years. And today we're going to ask her a few questions about her experiences working with the Urban Health Program. We'll ask her a little bit about what she's looking to pursue as a career. And hopefully through that conversation we'll be able to share with you some ideas that you might want to consider pursuing as you think about maybe going into one of the many health science career opportunities that are out there for you. Brianna, thanks for joining us today.
Thank you.
Well, let's start with just the basics. Tell us a little bit about yourself. Where are you from, and how you chose to come to UIC?
Well, I come from the south side of Chicago.
Mm-hmm.
I'm currently a junior at UIC, and I'm a kinesiology major. And I would like to pursue occupational therapy.
You don't want to sue occupational
No,
therapy?
not sue. Pursue occupational therapy. And I pretty much chose that career because I mainly want to help those who can't help themselves.
Mm-hmm.
And I feel like it's a growing field. So I would pretty much want to be a part of that field, help it grow, and just help others.
Very good. Now, you mentioned you're from the south side of Chicago, and
Yes.
and that's such an important element of the Urban Health Program. The program got its foundation, and we talked about this a little bit last week, if you were with us last week. The program got its foundation in the community. This was before your time, Brianna, but back in the 70s, there were community protests about the lack of physicians, the lack of pharmacies and dentists and occupational therapists and all those types of health care resources in the communities, in the urban communities in Chicago, specifically on the south side and the west side. And so folks protested, and the state legislature recognized that the best way to see that people go into those communities and provide those services was to recruit people from those communities. And so, Brianna, you're very much a living example of exactly what the Urban Health Program was intended to do. What high school did you go to?
I attended Kenwood Academy in Hyde Park.
Very good, very good. And tell us a little bit about your experiences here at UIC. Do you enjoy being a student in the kinesiology program at UIC?
I do enjoy the classes that I've taken at UIC. They're very rigorous and challenging,
Mm-hmm.
and that's something that I kind of wanted because I didn't want to. I pretty much wanted to just challenge myself,
Mm-hmm.
and I feel like UIC was one of the places where I could do that. And they have a very supportive kinesiology department. It's a lot of opportunities and a lot of help, a lot of resources that UIC offers.
Mm-hmm. Tell me a little bit about kinesiology. Some of our viewers out there might not understand exactly what kinesiology means.
Okay, kinesiology is pretty much the study of like movement,
Mm-hmm.
and it mainly deals with the body and motor exercise. There are a bunch of different routes that you can take with kinesiology, whether it's personal training, physical therapy, occupational therapy, nutrition. There's so many gateways. So that's pretty much what kinesiology consists of.
Sure. We had a one of your not one of your classmates, but someone who went a couple of years before you, who was a kinesiology major here on the show, maybe 2-3 years ago now, and he told us how he went on to be a personal trainer for several members of the Chicago Bulls, and so those are the types of opportunities that you can pursue with a kinesiology degree. Now, you mentioned that you were interested in occupational therapy.
Yes.
Tell us a little bit more about occupational therapy and what that involves, and how much more schooling are you going to have to go through to pursue that kind of a degree?
Okay. Occupational therapy is kind of like physical therapy, except occupational therapy is more so focused on those who are trying to get back into the workforce. So it deals with a lot of like stroke patients, like veterans who like lost limbs, children with like cerebral palsy, a lot of things like that. And an occupational therapist can work in any setting, such as a hospital, school. They can come to people's homes, and they pretty much help them to gain ability to do daily functions.
So you're working on life skill kind of things. How to open a jar as opposed to how to, whereas a physical therapist would be more focused on rehabilitating a muscle or a bone or a joint or something like that.
Right.
Whereas an occupational therapist is dealing with some very specific tasks to make sure that you have the motor skills to be able to do those things, right?
And as far as how much school you have to go through, it's pretty much you have to complete a master's, you have to be certified. So it's a good amount of school, and I say about 6 years, 6 to 8.
Okay. So 6 to 8 from the time you start, not from where you are.
Oh,
now.
no. No.
Very good. And now, you mentioned that you want to help people. Was there anything that happened in your life that kind of led you to have this passion for helping people? That, anybody that maybe was in your family that you recognized needed an occupational therapist?
Yeah, my grandmother, she had a very bad arthritis in her wrist, and I would always see my mom try to help her like gain control over her hands and whatnot. So I was always trying to figure out ways on how to get her hands to open up wider and how to grip things, and have alternative ways to just work with her hands. So it was always like kind of fun to figure out how to do things when you aren't able to do things like yourself in the right way.
I want to remind our viewers that this is a call-in show, and so if you've got any questions for either of us regarding the Urban Health Program, regarding any of the opportunities that are available through the Urban Health Program, any of the health careers that we might be talking about, certainly Brianna can answer your questions about occupational therapy, about kinesiology, and we'll have another student who will be joining us in just a short while as well to talk about other opportunities at UIC. But please give us a call if you've got any questions or if you want to join the conversation. The number is there at the bottom of your screen, 312-738-1060. Now, Brianna, you've had kind of a unique experience with the Urban Health Program, and not only have you benefited from the services available through the Urban Health Program, but you also work in the Urban Health Program office.
Yes, I do.
So tell us a little bit about that, and how has that changed your perspective on what we do in the Urban Health Program?
Working at the Urban Health Program, it's made me realize that students who are interested in health careers that attend UIC, they we are exposed to so many different resources and so much help. And I pretty much like that. There are a lot of staff that are willing to help and give you good advice on from applying to graduate school and resumes and anything to boost your academic career and on. So that's pretty much what I love about UHP, as well as they hold many events that help not just college students, but younger students, high school students, and alumni. So overall, I can say that UHP is very supportive of everyone.
Very good. And you know, you've raised such an important point, Brianna, and I have kids, I have sons who are about your age, and I tell them all the time that it's so important to take advantage of those resources that are available to you on campus. That there are so many people at a university, at a college, that want to see you succeed. And you're absolutely right. The Urban Health Program is one of those programs that really works to make sure that our students have the advantages that they need to be competitive and to succeed. And hopefully, you know, you're an undergraduate, so hopefully your participation in the Urban Health Program will help you when you're applying into graduate programs and those types of things. Very good. Well, Brianna, thank you so much for being with us today. We really appreciate your time and your sharing a little bit about your experience with the Urban Health Program. And for those of you who might want more information about the Urban Health Program, there's some information for you regarding the Urban Health Program, and you can see our web address there, as well as our phone number. Please give us a call if you've got any specific questions that don't get answered on the phone today. And we've got another Urban Health Program student with us here today. But before we do that, I understand we have a caller on the line. So, caller, did you have a specific question for us?
Yes, I do. I was listening, and I wanted to know, how does she work and balance school? Like, are there some techniques that she uses?
Okay, so how do you balance work with being in school? And you know what? I bet you can answer that for us as well.
Well, I'm actually a grad student.
Okay.
So I currently do not work.
Well, then that's a good way to balance.
Yeah. But when I was in undergrad, I did work. I did have a research related position, so that that kind of helped me not only have that network, but also balance school and associate my research with my degrees. So, but yeah, it's all about time management. Different things work for different people. You have to just keep trying and see what works for you, and don't give up, because it's going to be there's going to be ups and downs. There's going to be tough times. So just keep getting through it, and set yourself a schedule. And if it doesn't work, then try something new.
Very good.
And then, should I look for jobs on campus, or should I work off campus?
It depends. I think if you have the opportunity to work on campus, that could be a great way to meet different people that are in not only different fields, but can help you if you're taking some classes. And it's very convenient if it's on campus. They're more flexible with you having classes, you having exams, and if you go off campus, they may not be as flexible. So I would say try something small at first, and then see how that works out. And if you can go on campus, I would highly recommend it.
Okay, great. Thank you for your question, caller. And we have to let you introduce yourself.
Hi, everyone. Again, thank you for allowing me to be here. I am Angelica Legunez. I am a third-year DMD PhD student, so I'm right now in the College of Dentistry. So it's a 7-year program. It integrates dentistry with research. So you do a 1 year of dental school and then 3 years of research focusing on your PhD and your project, and then you finish off dental school.
Outstanding. That sounds like more school than even I would be able to handle, and I've been in school all my life, it seems.
Yeah.
Tell us a little bit about how you came to choose. Most people, when they think of going into dentistry, they don't necessarily think of doing it on a PhD level. They,
Right.
they think more, I'm going to, earn my DDO or DDS and
DMD.
and then go and practice, and
Right.
so going at it from a PhD sounds a little bit different.
Yeah, it's not very common, but it is possible. The reason I did it is because when I was undergrad, I really enjoyed research, and I, with having mentors, my research mentors, they were very supportive, and they just created this huge interest in research. So I wanted to explore that and continue that, go on to the next level. And then I found dentistry also. So I was really torn because I didn't really know that it can be combined, but once I came to UIC and looked at the program, I saw that it could be combined. So I was able to get into that program, and I'm happy with it. I feel like I'm doing the two things that I absolutely enjoy, and it is challenging.
I'm sure.
Yeah, it is challenging,
I'm sure.
but it's very rewarding.
Now, tell us, what does research in dentistry look like? What kind of projects might you pursue working on a PhD, working on a dissertation or something like that, or a project, a doctoral project in dentistry?
Right. With the PhD program, they want to do basic science. It's usually more basic science, and then it's into two. There's basic science, so it could be looking at wound healing, looking at oral cancer, looking at dentin and different parts of the materials of the teeth, biomaterials, and then if you want to do more clinical trials or more clinic-based research, that's a little bit different. With the PhD, you focus more on basic scientific training, so it's really preparing you to become a scientist and to learn and to create that foundation of learning, so that you can, once you finish that, you have the option, or you have the critical thinking skills to be able to move into either continue basic science or go into clinical research.
Outstanding. Now, tell us a little bit about your participation in the urban health program in the College of Dentistry. What kinds of support have you found as you've pursued your very specialized degrees through support from the urban health program and the folks there in the College of Dentistry?
Yes. Since I've started dental school, I've heard about the urban health program just the first month that I was there. So they hold a lot of events for students, and it's great because you get to meet a lot of other professions. So it's a great way to network. So not only networking, but while I was in dental school, they provided us with resources and in order to be able to succeed in our profession. So that's the biggest impact that I've seen with the urban health program.
Very good. You mentioned something that's, I think, very important, and that's the opportunity to network not only with other dental students, but with other students who are pursuing other health professions. And so much of healthcare these days is about a team approach to helping a patient or helping a population even. It's not just the doctor, it's not just the dentist, it's having lots of folks come at health problems from different directions.
Right, and I agree. I completely agree, and this just allows us to see the benefits of doing that. The communication between all types of profession is very important. And
the nice thing about the urban health program is because we work across the entire spectrum of the health sciences, you have an opportunity to meet other students who might look like you,
right?
Other students from diverse backgrounds and who have an interest in serving the community, but are coming at healthcare from lots of different angles. So I would think that when you graduate, you're going to be a wonderful resource to a lot of other healthcare providers because of your research background. And so you'll be able to talk to folks that have gone through healthcare management, through medical school, through pharmacy school, and all of you will be able to work together to do things, and you've got a network of folks already established that's going to help you be a part of that team.
Yes, I agree. And I have a lot of close friends that are in different disciplines, and they're also in the urban health program. So it's great to see not only them every year, but seeing them matriculate to the program and keeping them as networking contacts, and also meeting other students through them. So it's great.
Now, we had a chance to ask Brianna this, and we haven't asked you yet. Where are you from?
I'm from Tinley Park, Illinois, so
Okay.
it's a south suburb, and currently I'm in Chicago.
Okay, very good. I'm also a South Sider, so South suburban person, so
Yes.
I'm very familiar with Tinley Park, and I'm sure most of our viewers are as well. And was there anything that happened in your life? You mentioned that you had some mentors that kind of guided you toward research, but was there anything that happened in your life that kind of steered you toward the health sciences? Anything that inspired you to perhaps pursue something where you're helping others or serving others?
Actually, when I was in high school, I was part of a research program at the University of Illinois in Urbana-Champaign, and that actually got me really interested in science. Like when I
Okay.
was in high school, science wasn't my favorite subject. So, going there and working on with real professors on real research, that really opened my eyes as to how it actually is applied in the real world. So that really motivated me in that. As I went through school, I started looking more into, once I found dentistry, I started looking into helping others and looking into dentistry as a career.
Very good. Now, we're just about out of time, but I do have one more question for you. You just said that science wasn't necessarily a subject in high school, yet obviously, if you're going to, what would you recommend interest in any of the health sciences and research who might type of a career?
I would say to try to find different opportunities to be able to see what you like. Young, you don't know what you like. Had me in contact with the right people and the right resources. So just keep looking out, asking questions. Probably people in your guidance counselors or even your class. Apply for these programs because they exist. So just keep looking for things to do, things that interest you.
Very good. And thing that's such an integral program through our early outreach program in a week or two. Participate in graduates have an opportunity to work with faculty, and they're so very important to help. Well, thank you. We really appreciate it, and you've had an opportunity to hear from both an undergraduate and a graduate student. The Urban Health Program truly is a comprehensive pipeline program at all levels of their development as they pursue healthcare careers. And so if you've got questions about anything that we've talked about today, sciences, questions about opportunities that might be available to you at UIC, make sure you contact us. Again, there's our contact information. That's our website address, our main telephone number. If you give us a call, we can information again next week, where we'll talk to some more students or some other folks for the Urban Health Program in the University of Illinois at Chicago. I'm